Most people think a dangerous fall begins with a cracked sidewalk, a loose rug, or one careless step. But often, the real problem starts a few seconds earlier, when you stand up and begin walking before your body is ready. Your mind may already be at the mailbox or the end of the street, but your ankles are still stiff, your legs have not found their rhythm, and your balance system has not settled. So before your next walk, do one simple thing. Take 60 seconds to reset your balance before the first real step. This is not a workout, and it is not a difficult test. It is a short preparation that can help you notice dizziness, wake up the muscles around your ankles and hips, and begin with control instead of rushing forward on uncertain legs. Stay with me, because I will show you exactly how to do it, the mistakes that make it less effective, and the warning signs you should never ignore. Whether you are 62, 68, or already in your 70s, balance is not controlled by one muscle. It is a conversation between your eyes, inner ear, feet, joints, leg muscles, and brain. When those systems work together, your body can detect a wobble and correct it. But after sitting for a long time, getting out of bed, or riding in a car, that conversation may be slower. Your ankles may feel tight, your first steps may become short, and you may lean forward before your feet are ready. Some people also feel lightheaded when they stand, especially when they are dehydrated, affected by medication, or experiencing a drop in blood pressure. The answer is not to stop walking. Walking is one of the simplest ways to stay active as you age. The answer is to stop beginning every walk as though your body has already been moving for 10 minutes. Start beside a kitchen counter, a strong table, a wall rail, or another stable surface. Do not depend on a lightweight chair that could slide. Place your feet about hip-width apart, keep one or both hands close to the support, and stand still for a moment. Look straight ahead, not down at your shoes. Take one slow breath in and one slow breath out. Then ask yourself 3 questions. Do I feel dizzy? Do I feel unusually weak? Do I have new pain, numbness, or a feeling that one leg will not support me? The safest time to discover that you are unsteady is while you are beside support, not after you have stepped onto the driveway. If you feel lightheaded, sit back down and give yourself time. Do not force yourself to walk through dizziness. If it keeps returning, speak with a healthcare professional, because balance problems can have several causes and should not automatically be blamed on age. If you feel steady, begin with 10 gentle ankle movements. Keep your heels on the floor and lift your toes, then lower them. Next, keep your toes down and slowly lift your heels, then lower them. Alternate without bouncing. You are not trying to stretch as far as possible. You are asking the muscles at the front and back of your lower legs to switch on. These muscles help control the foot as it meets the ground and help you respond when your weight moves forward or backward. Gentle toe lifts also remind you to clear the floor instead of shuffling across it. Now keep your hands near the support and shift your weight slowly to the left foot. Return to the center, move to the right foot, and return again. Repeat 5 times on each side. Make the movement small. Keep your shoulders level and both feet on the floor. Walking is a series of controlled moments in which one leg supports you while the other moves. If your body does not trust the supporting leg, you may shorten your step, widen your stance, stiffen your knees, or reach for furniture. This slow weight shift lets you practice the transfer safely before doing it in motion. Next, march slowly in place for 10 steps. Lift one foot only a few inches, set it down quietly, and then lift the other. Keep your chest tall and avoid leaning backward. If lifting your knee makes you unstable, make the movement smaller. The goal is not to lift high. The goal is to coordinate one leg supporting you while the other foot leaves the floor. Move slowly enough that you could stop at any moment. If you must grip the counter tightly or your body sways sharply, continue using support and consider asking a physical therapist or healthcare professional to assess your walking and balance. Now set your posture before you move. Imagine the top of your head rising gently toward the ceiling. Relax your shoulders and look several steps ahead instead of staring directly at your feet. You still need to watch the ground, especially outdoors, but scan ahead with your eyes rather than bending your entire body toward the floor. Keep your arms free when possible. Carrying several bags, staring at a phone, or walking with both hands in your pockets reduces your ability to react if you stumble. If you use a cane or walker, have it within reach before you stand and use it as your clinician instructed. Then begin the walk at about half your normal speed for the first minute. Take comfortable, quiet steps. Do not force a long stride, and do not rush to prove that you can still walk quickly. Let your rhythm build gradually. Warming up by doing the activity more slowly allows your heart rate, breathing, muscles, and joints to move from rest toward activity in a controlled way. After the first minute, if you feel stable and comfortable, increase to a purposeful pace. You should still be able to speak without gasping. The biggest mistake is confusing speed with strength. A fast start can hide poor control because momentum carries you forward. A controlled start shows whether each foot is landing where you expect it to land. There are 4 mistakes to avoid. First, do not perform difficult one-leg balance drills immediately before leaving home unless a qualified professional has taught you how to do them safely. Your pre-walk routine should make you steadier, not tired or frightened. Second, do not begin with aggressive or painful stretching while your muscles are cold. Gentle movement is a better preparation for walking, while deeper stretching is generally more comfortable after you are warm. Third, do not ignore your shoes. Loose shoes, worn soles, slippery bottoms, or footwear that does not stay attached to the foot can increase instability. Fourth, do not rush because someone is waiting, the phone is ringing, or the weather is changing. Rushing removes the pause that helps you notice dizziness, stiffness, or weakness. This 60-second reset is especially useful after getting out of a car, standing after a long meal, rising from a soft sofa, or leaving home early in the morning. Some days you will feel strong immediately. On other days, poor sleep, illness, dehydration, medication effects, or joint pain may change the way you move. The routine cannot diagnose those problems, but it gives you a consistent checkpoint. Over time, you may notice patterns. Perhaps one ankle is repeatedly slower, or dizziness appears after a particular medication dose. Write that down and discuss it with your healthcare professional instead of changing medication by yourself. Also remember that this reset is preparation, not a complete fall prevention program. Long-term balance is supported by regular walking, leg strengthening, and balance practice. Older adults benefit from combining aerobic activity, muscle strengthening, and balance work during the week. Your daily walk is valuable, but it becomes more useful when supported by stronger calves, thighs, hips, and core muscles. A physical therapist can adapt exercises if you have arthritis, neuropathy, a previous stroke, Parkinson's disease, recent surgery, or a history of falling. There are also times when you should not repeat the routine and hope the problem disappears. Seek urgent medical help for a sudden new loss of balance, weakness or numbness on one side, facial drooping, trouble speaking, fainting, chest pain, or severe shortness of breath. Those are not normal signs of aging. For ordinary stiffness or mild uncertainty at the start of a walk, remember this sequence: pause, check, activate, shift, march, align, and start slowly. Stand beside support. Make sure you are not dizzy. Lift the toes and heels. Shift your weight from side to side. March gently. Look ahead. Begin with slow, controlled steps. It takes about 1 minute, but it changes how you enter the walk. Instead of throwing your body forward and hoping your feet catch up, you begin with attention and control. Practice this before every walk for 7 days. Notice whether your first steps feel smoother, whether you feel less stiff, and whether you begin with more confidence. The goal is not to make you afraid of walking. The goal is to help you keep walking, because every safe step supports your strength, independence, and freedom. Before you leave the chair, the house, or the car, remember this: your walk does not begin with the first step. It begins with the minute you take to prepare for it.